Your cat stops in the hallway and locks onto one small patch of wall like something is moving inside it. The ears angle forward, the body goes still, the eyes stay wide and fixed for far too long. Then it happens again the next night, and now you feel that weird little drop in your stomach because it no longer looks random. Sometimes your cat is picking up a sound, scent, flicker of movement you cannot detect. Sometimes that same wall staring is one of the earliest visible signs that something is wrong with hearing, vision, balance, blood pressure, or even the brain itself. In a minute, you'll know the difference between harmless hunter behavior and the kind you should never brush off. This is not superstition. Cornell's Feline Health Center has explicitly listed long periods of staring at walls or blank space as a possible sign in older cats with cognitive dysfunction, and veterinary neurologists also warn that abnormal wall fixation can show up with seizure disorders, balance problems, or forebrain disease. So this behavior deserves context, not ghost stories. You're about to get the full list in order, from the most relatable reason to the one that can change your cat's life fastest. And pay close attention to number 10, because that is the point most people only learn after they've already lost time. If your cat has been doing this more often, longer, or with any other odd change, the next few minutes could spare you a very painful miss. Cornell Feline Health Center number 1. Insect infestation. Your cat may be detecting a tiny living target, not nothing at all. Cats can see small motion in dim light far better than you can, and they can also hear and smell activity inside a wall cavity long before you notice it. A veterinary-reviewed cats.com explainer notes that cats can fixate on dust, spiders, insects, wall sounds, or scent trails you never pick up. So if the staring happens near baseboards, outlets, or the same corner every night, pay attention. Watch for sudden pawing at the wall, tail twitching, crouching, or late-night patrols in one part of your home. One simple action: check the area with a flashlight and inspect for bugs or small entry points before assuming the behavior is mysterious. Cats.com number 2. Rodent activity. Sometimes the wall really is talking to your cat. A cat's hearing is so sensitive that faint scratching, squeaking, or movement in a cupboard or wall cavity can hold their attention like a magnet. Loveland Regional Animal Hospital explains that cats may stare at a wall because they hear a tiny mouse or other movement that humans miss completely. That is why some cats freeze, then make tiny head adjustments as if they are triangulating sound. Alongside the staring, watch for your cat rushing to the same cabinet, sniffing vents, or becoming unusually alert at night. Your action here is practical. Listen after dark, inspect food storage areas, and rule out a pest problem before you move on to medical causes. Loveland Regional Animal Hospital number 3. Feline hyperesthesia syndrome. This one can look like your cat is reacting to something invisible, but the sensation may be happening inside the body. Feline hyperesthesia means extreme skin sensitivity, usually along the back, and that discomfort can make your cat freeze, dilate the pupils, stare, overreact, then suddenly lick, bite, or sprint away. Cornell notes that some cats drool, vocalize, or chase the tail during these episodes, and Dr. Alexander de la Junta believed some cases may represent a seizure-type problem. What you should watch for is a pattern: wall staring followed by skin rippling, frantic grooming, biting at the lower back, or touch sensitivity. Your next step is to film an episode and book a veterinary exam, because pain, parasites, spinal problems, and neurologic disease all need to be ruled out first. Cornell Feline Health Center number 4. Otitis media or inner ear disease. When the middle or inner ear is inflamed, infected, or damaged, your cat may become hyper-aware of strange internal sensations and external sounds at the same time. That can make them pause, stare, tilt, and orient toward walls or corners while trying to make sense of distorted hearing and balance signals. A clinical review in today's veterinary practice reports neurologic signs in 70% of one 16-cat non-suppurative otitis media group, and a 26-cat series found neurologic signs in 15 cats, with head tilt being especially common. Watch for ear scratching, head shaking, one-sided tilt, facial asymmetry, or new reluctance to jump. One clear action: have your vet examine the ears promptly instead of waiting for discharge, because some deeper ear problems hide surprisingly well. Today's veterinary practice PMC number 5. Uveitis or early retinal disease. If vision starts changing, your cat may stare at walls because contrast, shadow, and light no longer look normal. The wall itself can become a visual anchor when the room feels less reliable. Cornell ophthalmology sources note that diseases like uveitis and retinal detachment are major causes of feline blindness. And cats with fading sight often give behavioral clues before owners realize vision is slipping. What you should watch for alongside the staring is squinting, swollen third eyelids, enlarged pupils, hesitating in dim rooms, or misjudging jumps they used to make easily. Your action is simple and time-sensitive. Look closely at both eyes tonight and schedule an exam fast if anything looks uneven, cloudy, or inflamed. And from here, the causes get more urgent, not less. Cornell Feline Health Center number 6. Systemic hypertension, high blood pressure in cats is dangerous because it can quietly damage the retina until the cat suddenly seems obsessed with walls, corners, or empty space. The cat is not being dramatic. The brain is trying to interpret a world that just became visually unstable. Cornell's ophthalmology guidance says elderly cats with hypertension may reach the point where the last bit of vision goes, and VCA notes sudden blindness can show up as bumping into furniture, freezing, or moving less than normal. Watch for wide pupils that do not respond well to light, fear in familiar rooms, or trouble finding the food bowl. Your action is urgent. Get a blood pressure check immediately, especially if your cat is older or has kidney disease or hyperthyroidism. Cornell Feline Health Center VCA Animal Hospitals number 7. Feline cognitive dysfunction in senior cats. Wall staring can be one of the clearest signs that the brain is aging in a way that goes beyond normal slowing down. The mechanism here is disorientation. Your cat may lose track of place, purpose, or time, then stand facing a wall because the brain no longer processes the environment smoothly. Cornell says signs become noticeable in cats 10 years and older and can include long periods of staring blankly into space or at walls, wandering, vocalizing, and litter box changes. What you should watch for is the cluster: night crying, getting stuck in corners, altered sleep, or seeming lost in a familiar room. One action matters most. Do not label it just old age until your vet rules out pain, thyroid disease, kidney disease, hypertension, and neurologic problems. Cornell Feline Health Center number 8. Vestibular syndrome. This is the balance system going wrong. The inner ear and lower brain normally tell your cat where the head is in space. So when that system misfires, the room can feel like it is shifting under their paws. A cat may brace near a wall, stare into a corner, or freeze because standing still feels safer than moving. Cornell's doctor, Marnie Fitzmaurice, describes classic signs including head tilt, falling to one side, and rapid eye movements called nystagmus. If your cat suddenly seems glued to a wall, look for wobbling, circling, vomiting, or eyes flicking side to side. Your action is to limit stares and jumping right away and get urgent veterinary help, because vestibular episodes can look temporary but can also reflect infection, toxins, inflammatory disease, or tumors. Cornell Feline Health Center number 9. Focal seizures. Some seizures in cats do not look like the dramatic collapse people expect. They can look exactly like, "My cat is staring at the wall and acting weird." With a focal seizure, only part of the brain misfires, so your cat may stay upright while staring into space, chewing the air, drooling, making jaw movements, snapping at nothing, or briefly seeming mentally absent. Small Door Veterinary lists staring off into space and chewing imaginary gum among common focal seizure signs. And Southeast Veterinary Neurology warns these episodes are easy to mistake for quirky behavior. Watch for repeat episodes that start and stop suddenly, especially if they look identical each time. One clear action: record the event on your phone and call your vet the same day. Small Door Veterinary Southeast Veterinary Neurology number 10. Brain tumor or forebrain disease. This is the reason you do not wait if wall staring starts coming with circling, personality change, blindness, seizures, or getting stuck in corners. When the forebrain is inflamed, compressed, or invaded by a mass, your cat may act like the wall has become the whole world. Cornell's Dr. Alexander de la Junta said that when a cat seems in a world of its own, paces in a circle, or gets itself in a corner and stays there, he considers a prosencephalon problem. A study of 61 cats with intracranial tumors found forebrain involvement in 54.1% of cases, and seizures occurred in 23%. Watch for sudden mental dullness, repeated cornering, new imbalance, or odd aggression. Your action is immediate veterinary evaluation, not watchful waiting. Cornell Feline Health Center PMC in Albany, New York. A cat named Patty starts doing something that looks small at first. He walks in circles. He stares at blank walls. Christine Ford feels that chill every cat owner knows, the one that says this is not normal, and she takes him in fast. An MRI confirms 3 meningioma brain tumors. That moment could have ended in helpless waiting, but it doesn't. Christine and her friend Rita drive more than 700 miles from Albany to Cincinnati for stereotactic radiation treatment. A year later, Patty is no longer showing those symptoms, and the tumors have shrunk significantly. The reason that story matters is not that every outcome will look like Patty's. It is that Christine moved when the signs were still only signs. She did not wait for collapse. She listened when the behavior stopped making sense. Pet cure oncology. So here's the fast recap. Insects, rodents, hyperesthesia, ear disease, eye disease, high blood pressure, cognitive decline, vestibular trouble, focal seizures, and forebrain disease can all make your cat stare at a wall for reasons that are completely real and sometimes medically urgent. If this behavior has happened in your home, comment with one specific detail. Where does your cat stare most often? And what other change showed up around the same time? That one detail helps more people connect the dots early. If someone you love has ever laughed off this behavior as cats being weird, sharing this video could be a genuine gift to their cat. And the next video goes even deeper into the silent behavior change that shows up before many owners realize a serious illness has already started. Sometimes the wall is the first warning you get.